A heart attack, also called a myocardial infarction, happens when a part of the heart muscle doesn't get enough blood. The more time that passes without treatment to restore blood flow, the greater the damage to the heart muscle. Is chest discomfort an early sign of a heart attack? What about heartburn? There are a lot of signs that your body will feel a month before a heart attack might strike. In this video, we will be talking about that and the causes of a heart attack. So stay tuned and keep on watching to learn more. Number 1. Chest discomfort. It's the most common sign of heart danger. If you have a blocked artery or are having a heart attack, you may feel pain, tightness, or pressure in your chest. Everyone has a different word for that feeling. Some people say it's like an elephant is sitting on them. Other people say it's like a pinching or burning. The feeling usually lasts longer than a few minutes. It may happen when you're at rest or when you're doing something physical. If it's just a very brief pain or if it's a spot that hurts more when you touch or push on it, it's probably not your heart. You should still get it checked out by a doctor. If the symptoms are more severe and don't go away after a few minutes, you should call 911. Also, keep in mind you can have heart problems, even a heart attack without chest pain. That's particularly common among women. Number 2. Nausea, indigestion, heartburn, or stomach pain. Some people have these symptoms during a heart attack. They may even vomit. Women are more likely to report this type of symptom than men. Of course, you can have an upset stomach for many reasons that have nothing to do with your heart. It could just be something you ate after all. But you need to be aware that it can also happen during a heart attack. So if you feel this way and you're at risk for heart problems, let a doctor find out what's going on, especially if you also have any of the other symptoms on this list. Real quick, hit that like button and let's get back into it. Number 3. Pain that spreads to the arm. Another classic heart attack symptom is pain that radiates down the left side of the body. It almost always starts from the chest and moves outward. But I've had some patients who have mainly arm pain that turned out to be heart attacks. Number 4. You feel dizzy or lightheaded. A lot of things can make you lose your balance or feel faint for a moment. Maybe you didn't have enough to eat or drink, or you stood up too fast. But if you suddenly feel unsteady and you also have chest discomfort or shortness of breath, call a doctor right away. It could mean your blood pressure has dropped because your heart isn't able to pump the way it should. Number 5. Throat or jaw pain. By itself, throat or jaw pain probably isn't heart-related. More likely, it's caused by a muscular issue, a cold, or a sinus problem. But if you have pain or pressure in the center of your chest that spreads up into your throat or jaw, it could be a sign of a heart attack. Call 911 and seek medical attention to make sure everything is all right. Number 6. You get exhausted easily. If you suddenly feel fatigued or winded after doing something you had no problem doing in the past, like climbing the stairs or carrying groceries from the car, make an appointment with your doctor right away. These types of significant changes are more important to us than every little ache and pain you might be feeling. Extreme exhaustion or unexplained weakness, sometimes for days at a time, can be a symptom of heart disease, especially for women. Number 7. Snoring. It's normal to snore a little when you snooze, but unusually loud snoring that sounds like gasping or choking can be a sign of sleep apnea. That's when you stop breathing for brief moments several times at night while you are still sleeping. This puts extra stress on your heart. Your doctor can check whether you need a sleep study to see if you have this condition. If you do, you may need a CPAP machine to smooth out your breathing while you sleep. Number 8. Sweating. Breaking out in a cold sweat for no obvious reason could signal a heart attack. If this happens along with any of these other symptoms, call 911 to get to a hospital right away. Don't try to drive yourself. Number 9. A cough that won't quit. In most cases, this isn't a sign of heart trouble, but if you have heart disease or know you're at risk, pay special attention to the possibility. If you have a long-lasting cough that produces white or pink mucus, it could be a sign of heart failure. This happens when the heart can't keep up with the body's demands, causing blood to leak back into the lungs. Ask your doctor to check on what's causing your cough. Number 10. Your legs, feet, and ankles are swollen. This could be a sign that your heart doesn't pump blood as effectively as it should. When the heart can't pump fast enough, blood backs up in the veins and causes bloating. Heart failure can also make it harder for the kidneys to remove extra water and sodium from the body, which can lead to bloating. Number 11. Irregular heartbeat. It's normal for your heart to race when you are nervous or excited, or to skip or add a beat once in a while. But if you feel like your heart is beating out of time for more than just a few seconds, or if it happens often, tell your doctor. In most cases, it's caused by something that's easy to fix, like too much caffeine or not enough sleep. but occasionally it could signal a condition called atrial fibrillation that needs treatment, so ask your doctor to check it out. Heart attack causes. The leading cause of heart attacks is coronary heart disease. This is where plaque builds up in the arteries that supply blood to the heart. The general buildup of plaque in the arteries is also known as atherosclerosis. There are two main types of heart attacks. Type 1 heart attacks are where a plaque on the inner wall of the artery ruptures and releases cholesterol and other substances into the bloodstream. This can then form a blood clot and block the artery. In type 2 heart attacks, the heart does not receive as much oxygen-rich blood as it needs, but there is not a complete blockage of an artery. Other causes of heart attacks include torn blood vessel spasms, drug misuse. Hypoxia is a lack of oxygen in the blood. Heart attack risk factors. Several factors can put you at risk for a heart attack. You can change some factors such as age and family history. However, you can make changes related to modifiable risk factors. Modifiable risk factors that you can help control include smoking, high cholesterol, obesity, lack of exercise, high levels of stress, diabetes or pre-diabetes, eating a diet high in trans fats and saturated fats, excessive alcohol consumption, sleep apnea. Heart disease is the leading cause of death among most ethnic and racial groups in the United States and the most common cause of heart attacks. If you're over 65 years old, your risk of having a heart attack is greater than people who are under age 65, according to the National Institute on Aging. This is particularly the case for women. Also, if you have a family history of heart disease, high blood pressure, high cholesterol, obesity, or diabetes, you may have a higher risk of having a heart attack. How is a heart attack diagnosed? Doctors typically diagnose a heart attack after they perform a physical exam and review your medical history. Your doctor will likely conduct an electrocardiogram (ECG) to check your heart's electrical activity. An echocardiogram, which uses sound waves to create an image of the heart's chambers and valves, can reveal how blood is flowing through the heart and what parts of the heart, if any, have been damaged. Your doctor may order a cardiac catheterization. This is a probe inserted into the blood vessels through a flexible tube called a catheter. It allows your doctor to view areas in and around your heart where plaque may have built up. They also inject dye into your arteries, order an X-ray to see how the blood flows, and view any blockages. Your healthcare team will likely also take a sample of your blood or perform tests to see if there's evidence of heart muscle damage. What do you want to learn next? Let us know in the comments below.